Okay, quick question. Would you rather pay $1,300 a month or around $300? Because that is the kind of math patients are doing right now with compounded GLP-1s. And honestly, the numbers are changing everything. If you have seen the headlines, Ozempic shortages, media buzz about semaglutide, pharmacies suddenly offering weight loss injections on TikTok, yes. This story is a lot bigger than just cost. It is about who is getting treated and who is getting left behind. I'm a pharmacist, and you are watching Pharmacist online, where no fluff, just the stuff you really need to know. Let us talk economics. Because of this whole explosion in compounded GLP-1s, it is happening for one reason. Supply and demand snapped. In 2024, everyone went crazy for semaglutide. Millions jumped on weight loss prescriptions, fueled by TikTok trends and celebrity buzz. Meanwhile, Novo Nordisk could not keep up. Pharmacies were in a frenzy, and what about the patients? Well, they started searching for anything that worked. Enter the compounders. Legally, when a drug like Ozempic or Wegovy is listed as shortage, the FDA allows 503A compounding pharmacies to step in. They are not making exact copies, but they are mixing semaglutide salts, like semaglutide sodium or acetate, with vitamin B12 or other additives in tiny custom batches. Now here's where it gets tricky. The price difference is jaw-dropping. Name brand Wegovy, $1,300 a month, if you can find it. Some compounders, just $200 to $400 cash. No insurance needed. No prior authorization hassle. But what does that low price really mean? Well, some patients say, "This saved me. I lost 30 pounds. I could not afford the brand." Others say, "I felt nothing, or I got bad nausea." Or, "I do not even know if what I got was real semaglutide." And that is the wild west we are in. Because compounding is unregulated territory compared to the rigorous approval process big pharma faces. Quality control depends on the pharmacy. Not all are shady, but not all are clean either. Quick Reddit quote I saw last night. "My GLP-1 came in a bottle with a handwritten label and no lot number. Should I be worried? Yes, probably. But let us zoom out for a second. Why are patients taking that risk? Because the system kind of forced them to. High prices, brand shortages, delayed insurance coverage, doctors unsure where to refer patients. So naturally, people did what they always do. They adapted. Now, from an economic standpoint, this is fascinating. Compounded GLP-1s became the substitute good. Classic microeconomics. When price goes up and supply drops, the market finds a workaround. Only this time, the workaround involves injecting peptides into your body. And by early 2025, some compounding pharmacies report 10 times the volume of GLP-1 prescriptions compared to last year. That is not a trend. That is a seismic shift in patient behavior. Here is the million-dollar question, though. Will the FDA shut this down as supply normalizes? Or will compounded semaglutide carve out a permanent niche, like how some people still use compounded hormones? I will leave that open. But I will say this. Patients are smart. They ask questions. They compare prices. And right now, they are weighing the value of trust against the cost of access. So, what do you think? Would you use a compounded GLP-1 if the brand was backordered for 6 months? Drop your thoughts in the comments. I read everyone. And if you want to understand exactly what these compounders are mixing into those GLP-1 syringes, that is in the next video. It is called Inside the Vial: What is Really in Compounded Semaglutide? Click through. I will meet you there.